public health is continuing surveillance on every possible case, but as of this time we have no confirmed cases of swine flu in Los Angeles County. There are at least 11 cases in the state of California and 91 cases nationwide as of this morning. What's particularly important is that the flu that is being talked about as swine flu in this country is very similar in its symptoms to the seasonal influenza that we continue to have. We are towards the tail end of that season, but we're continuing to have both type A and type B of the seasonal influenza. And the pattern that we're seeing nationally with swine flu is very similar, if not indistinguishable, from what we're seeing with seasonal influenza. So that suggests we need to take, at this point, the same approaches as we do to seasonal influenza. So it becomes everybody's opportunity to reduce their risk of getting any kind of influenza. And that means washing your hands. And if you want to know how long to wash your hands for, you want to sing the ABC song that you learned in preschool, or you can sing Happy Birthday and sing it twice. And also remember to wash under your nails as well, because that's one of the places that you can have virus, where your nails and the flesh meet. Secondly, cover your cough, cover your sneeze, so you don't, in fact, if you are coughing or sneezing, increase the risk of infecting other people. Don't touch your eyes or your nose or your mouth with your hands. Remember that this is a virus that can be on some inert surface, and you can touch that surface like a doorknob or a phone and then wind up, unfortunately, infecting yourself by touching a mucous membrane such as your eye or your nose or your mouth. And above all, if you are ill, don't go to work and don't send your child to school if your child is sick, because that's the way oftentimes this gets spread. So those are really critical points. The other point is that there is no reason for the average person in public going to a gathering or otherwise to wear a mask. There's no evidence that wearing masks reduces your risk of getting influenza. Now, it's a different question if you happen to be in a healthcare facility, if you go to an emergency room and they're trying to separate you from other people, and you may have those symptoms. But there's no reason for the general public to be wearing a mask. Just like regular influenza, the most important treatment for this is what you do for yourself at home. And let's remember the symptoms of all these cases of influenza are fever, lethargy, a dry cough, a runny nose or a stuffy nose, sometimes backache, and feeling extremely tired. And if you simply treat yourself symptomatically, almost every time that's going to resolve. If you have any concerns, call your doctor. But in many cases, it's better to call your doctor before you, in fact, go into your doctor, because you may wind up with a long wait. And if you don't have influenza and you have something else, you're also going to have the potential of increasing your risk of being infected by other people who could be there. So home treatment is very important, and what we normally do for influenza anyway, unless you have some underlying condition or some other problem. Certainly, you don't want to treat this with a prescription you may have had left over with an antibiotic. First of all, antibiotics are not successful against influenza, only some complications of influenza. And you also don't want to go out and try and treat yourself with any antiviral drugs. Again, if there's a need for drugs, you need to work with your doctor and get a prescription. There's also no reason not to go to a large gathering any more than you would during the regular flu season. So we have Cinco de Mayo coming up, and we hope everybody will enjoy that celebration and other celebrations that might be coming up for you and your families out there. But on the other hand, if you're sick or if your child is sick, then you shouldn't go to a crowd. You shouldn't be part of a crowd. You shouldn't go to that kind of celebration, because you increase the risk of infecting other people. And finally, I want to be absolutely clear that you can't get swine flu from eating pork. There is no reason not to eat pork products. Let's remember what this swine flu virus is. It's a novel virus. It's a new virus that we haven't seen before. It is something that in fact can be transmitted from person to person. It has caused outbreaks in communities, which is why we're seeing it both in the United States and elsewhere. And those are the reasons that the World Health Organization has put us on alert, and we are at stage 4 out of 6 in terms of the possibility of a pandemic. But again, what we're seeing in the United States at this point is not different than what we're seeing with the symptoms of regular influenza. We are looking very hard at the pattern of this disease because we want to understand why the pattern in the United States appears, although we're not sure it is, different than what we've seen in Mexico, where there have been more severe cases reported. And so we are tracking this on a round-the-clock basis, but our effort is really to try and understand the pattern of disease. I still think it's inevitable we will find cases in Los Angeles County because we're just too big and we have too much travel between here and Mexico not to have any cases of swine flu. But that doesn't mean it can be distinguished clinically from a case of regular flu.